Hi, everyone. Welcome back for the second episode of From Pregnant to Parent Presents. I'm Richelle, the founder of From Pregnant to Parent. If you're new around here, I am a childbirth educator. I'm a toddler mom based in the Bay Area. And we created this space just to help you learn more about what your options are out there, help you to feel confident as a new or an expecting parent, and just to empower you and encourage you to ask questions, to find options. And to trust yourself. I'm so excited. I'm here today with Dr. Natasha Sriraman. She's a pediatrician. She's an author, an advocate, and all around superwoman of a mom. And I'm so excited to have you here today to chat with us. I'll go ahead and pass it off to you to tell just a little bit more about yourself and your background.
Hi, everyone. Thanks so much for having me. We found each other on Instagram, and I absolutely love the messages you're sending. So thanks for having me. Like she said, my name is Natasha Sriraman. I am a pediatrician. I work with medical students and residents every day. So I think a lot of my messaging is important because while I'm reaching a lot of moms through my social media, I am also teaching the future physicians and future pediatricians. So that's always fun. What we were talking about before we started recording is that I pride myself on the fact that as a pediatrician, yes, I do have the evidence. I went to school for a long time and I see this every day as a pediatrician, but the fact that I'm a mother of three and much of my postpartum journey is the impetus for what I do, just for what I went through, and hoping that other mothers don't go through that, or at least have more support than I had and many of my friends did many years ago, but also just to kind of really empower moms through this journey called motherhood. I know we're going to focus on the initial postpartum period, but like what we were talking about, the postpartum period goes on, and I think it's just moms supporting moms and empowering us to make decisions, whether they are 18 months old like your son or 18 years old like my daughter, and just to really kind of hone in on that, what I like to call the fourth trimester, because I feel that once the baby is born, and that's wonderful, and I love that aspect of seeing my newborns, but a lot of my focus is on the mother, because it's just the way postpartum care is unfortunately set up in this country. Once the baby delivers and the baby comes into this world, a lot of times mom is forgotten about.
I love that. That's so important. I know before we started recording, we were talking a little bit about just kind of that realization that I had even. I'm fortunate enough that my son's primary care provider is also my primary care provider. So she is so wonderful at kind of checking in on me that I never really thought twice about it. But, in connecting with you, and you wrote a phenomenal article for the New York Times, and reading your article and just realizing that your child's pediatrician is the person who's going to see you the most in the postpartum journey, and what that means and what that looks like, and remembering and knowing as new moms that it's okay to use your pediatrician as a resource, as a safe place to kind of share when you are having those concerns or those issues with, bonding or breastfeeding or, mental health or kind of whatever that is. So I'm so glad that, you bring that up, that you're talking about that, raising awareness about that, advocating that, normalizing that. It's such a beautiful thing. So I want to start first with just, I think, finding in any of our care providers, right? Just finding someone who we feel really comfortable with, and having that great relationship. What advice do you have for new and expecting parents when it comes to finding a pediatrician that, that they really can feel comfortable with and feel safe with, and build that really great relationship with?
I think for me, even just on a personal level, as well as the patients I see, I trained in New York, so all my children were born in New York, but now I live in Virginia, so I kind of had to do it twice. And I think first and foremost, talking to your obstetrician, because you're going to be seeing this physician for your entire prenatal course, and a lot of times the obstetricians really know the pediatricians in the community really well. So I think that's a great resource, but I honestly think, talking to your friends or your neighbors, for me, a lot of it was my neighbors, they had older kids. They just kind of told me, who they trusted, who they were seeing. And it was a really good feedback because, a lot of the times the friends you spend time with or the neighbors you spend time with, you have a lot of the same values and things in common. And that's always a great way to find that pediatrician. I don't know if this is happening. I don't know if this is happening in California. I know we were doing it in New York, which does not happen here in Virginia. What we were trying to do when I was in training was actually do prenatal visits, but on the pediatric level. So what I had started doing was bringing these moms in while they were pregnant. A lot of times they would know me or know of me because, I was seeing, one of their friends' kids or a family member. And we were doing these prenatal visits, but actually for on the pediatric side. So the moms would come in, like you would come in when you were pregnant. And I would just tell you really a lot of logistics, because I think that's where we get lost. Like I remember, when we joined a practice and my kid was sick on a Saturday, I was like, wait, what do I do now? Because I knew he needed to be seen. And I was like, I don't really want to go to the ER because I know it's nothing emergent. So I just, I would go over logistics. Like, these are my partners. If you come in for a sick visit, you may not see me. You'll see, so-and-so. And this is, who you call at night. This is who you call on the weekends. Once you deliver, here's the phone number I want you to call, or have your spouse or your partner call to make that appointment. I want to see you within X amount of days after you deliver. And then I would just kind of go over what we would do, like those first few visits. Like I would go over, this was back in the day before computerized, but, I would kind of go over the paper chart and then and then a lot of that messaging turned into breastfeeding, because most of the decisions we make as women and infant feeding are actually, we make them while we're pregnant. And we don't really talk about breastfeeding or formula feeding while we're pregnant because we're focusing on our own health and things like that. And obstetricians don't have time to really review that. So for me, it kind of turned into the breastfeeding piece because, again, that's not what I didn't get any of that with my first child. So it was really great because it was just, it was really fun. And, we would have these little prenatal sessions. Sometimes we would do one-on-one, and sometimes we would do the group setting and things like that. So I think that would be a really great thing to do. Like I said, it really depends. I think it depends regionally and on the pediatric practice because, again, it's time. It's nothing, it's nothing that you can bill for, unfortunately. But, but a lot of practices do it. And I don't know, maybe they, California is pretty progressive like New York. So maybe they're doing it more of it. But I think just talking to the people that you interact with on a part of that community for a long time.
I love that. And just the idea of getting to know each other, touching base, getting some of that, I think sometimes knowing what to expect can help to counteract some of our fears of, what's coming and, just help us to feel more settled and more comfortable kind of walking in into that new role. I remember, going to my first appointment with my son and not really knowing what to expect and still kind of really wrapping my head around the fact that I am the parent here in this appointment, and it's not about me and we're making decisions for him. And I think kind of just knowing a little bit more of what to expect and who to call. I think that's so important too. And just knowing.
Well, I think what was happening, what I was at least seeing in my practice in New York City was that, just say you would get discharged on a Friday. And maybe you have an appointment with me Monday or Tuesday, on a Saturday. And that was the gap that we were seeing, those 2, 3, 4 day gap that you didn't belong to the hospital anymore because you were discharged, but you didn't really belong to me because you weren't technically not my patient yet. And this big gap that was happening. So, I don't want that 4-day-old to go to the emergency room. I don't want, because it's not like you could call and say, well, you're my pediatrician. You don't know me yet, but it logistically it became really difficult. So that was kind of why I started doing these visits in New York when I could fit them in, because that was the gap that I was seeing. And those 3-4 days of I don't know about you. I remember when I went home, and this is what I do for a living, I was terrified. I was literally terrified. I didn't know how to breastfeed. She wouldn't stop crying. And I think everyone assumed it was well, you're a pediatrician, or you're, training to be a pediatrician. You kind of know what you're doing. It's no, you don't. It's totally different, when you're learning about it or studying about it as opposed to having a child and having the baby.
there's only so much that we can prepare for, and we can work on building that confidence and learning to ask questions and trying to think, but there's something about just getting into that experience, and I think stepping into that identity, that's so different. When would you say, is that, like, when would you encourage expecting parents to start looking for a pediatrician and reaching out and kind of making that that contact?
I would definitely, probably in that early to mid trimester, it may vary, if you have a risk of, obviously for our moms who may have risk of preterm labor and miscarriage, that may be a little bit different. But generally speaking, probably like that early to mid third trimester, just to kind of give that lag time that, maybe you deliver a few weeks early and things like that. So you're not waiting till like, you're 35 weeks and then you deliver at 36 weeks. But I think that's always a good time to just, because also remember the first pediatrician I don't, depending obviously if you can meet them, but that first pediatrician may not be a good fit. So you don't want to just assume like the first one I call and that's good. It's a good deal, but it may not be a good fit. And then, based on everyone's insurance, you're going to have a choice of the pediatrician. So you want to have enough time to be able to talk to more than one.
It's such an important thing to bring up and think about, because I think you're right. We get kind of caught up in our OB visits and preparing for childbirth and that big monumental moment. And that sometimes it can be, I know for me, that moment was so distracting from preparing for, okay, what comes next? So I know I did a little bit of a scramble in that third trimester when all of a sudden it was like, oh, right. Like I need to do all these things too. There's an after once the baby's here.
Right. Because a lot of times, depending on the hospital you deliver, if you don't have a pediatrician picked out, they're going to pick one out for you, because their goal is like, we cannot let a newborn leave the hospital without an appointment. I mean, that's not safe. So, if a mom across the street doesn't have a pediatrician, they're going to send them to my practice because of the proximity and they know me and things like that. So, you kind of want to avoid that, because like you said, it's, you do all this planning while you're pregnant with your OB visits, and then you have the showers and the gender reveals and, painting the nursery. It's like really kind of, again, we're so focused on the pregnancy, which is important. And that kind of, maybe, but no one's kind of thinking ahead to that postpartum side. And that I always talk about the importance of a postpartum plan, because you think you're going to have a lot of time when you come home with a baby, and you and I both know that's not true.
Right. Yeah. I remember even talking to some friends, like the expectation that, and I go on maternity leave, maybe I'll start a blog, or maybe I'll work on, the project around the house, or, you're like, oh, I've got some time off, like I'll pick something else up. And then it's, no, you are 100% focused on sleep. And did I eat? Did the baby nurse? Is the baby fed? Am I fed? Or who's sleeping when? Did I shower today? Like there's
right.
plenty to keep you occupied.
Yeah.
And then in terms of those well child visits, I think, like, what's typical? What can you expect from a well child visit? Again, for me, I hadn't put a whole lot of thought into it. So I, walking into this first visit and really trying to understand, well, how often are we going and what's going on? And, I know it's probably different a little bit from practice to practice, but it's a little different from just like your annual physical, right?
Right. And I think, based on, when I do these talks, people are shocked at how many times I see the baby in a year just for well checks. That doesn't count if you're coming in for a cold or any concerns. And that was the impetus of my article for the New York Times. And why I do this is because I see moms so much. So you're discharged. We want to see the baby within 48 to 72 hours. Obviously, if it's a Friday, we're going to see them Monday. We have to check, obviously, weight. We have to check issues with jaundice. My breastfeeding moms, I do keep a closer eye on. I am a breastfeeding medicine specialist, lactation consultant. So, I kind of know, what to look for. I may give moms a little more leeway in terms of the time I'm going to give the baby to feed versus, those who may not be as, as well versed in it, as opposed to, kind of giving the baby a bottle immediately and things like that. I give some kind of lag time to those moms and babies. And then of course we have to think about, was the baby early? Was the baby, a few weeks early? Was the baby 5 weeks early? I just had, twins today, and I was trying to explain to mom, like, the baby has to learn how to breastfeed. Remember, the baby's, still technically supposed to be in your womb. It's kind of a learning process. She's learning you and you're learning her. And so, that first visit within 48 to 72 hours. And of course, assessing things as weight and jaundice and breastfeeding. But if everything is good, next visit would be like a 1-week weight check. We want to see every baby is going to lose weight. We want to see the baby regain the birth weight within 10 to 14 days. So we are going to keep a close eye on that because we don't want the baby to dip really low. And like I said, I don't really just pay attention to numbers. It's kind of the holistic picture. Like, I'm not going to look at this number and be like, oh my gosh, breastfeeding's not working, here's a bottle. Or I'm not going to look at like, oh wait, no, everything's perfect, I don't need to see you for a month. It doesn't work like that. So, if everything is good on that first visit, I'll do a 1-week weight check. I may bring them back more frequently if I have to recheck a bilirubin, if I'm worried about the weight. For my breastfeeding mothers, like I said, I keep a closer eye on them. And then I always do a 1-month weight check. I know a lot of pediatricians do not do that. My feeling is that if I see the baby at 3 or 4 days, post-delivery, and the next visit there may be like 10 to 14 days, I feel like from 2 weeks to 2 months, that's a 6-week gap. And I feel like that's a really long time to not just see the baby, but to not see mom, because moms can go through a lot. And we have to understand that the next time you're going to see the OB and get screened for postpartum depression, and for the OB to look at you, your physical findings, whether it's the pain, whether it's the episiotomy, whether it's the C-section, a lot can happen in 6 weeks. And what I was seeing, the reason I started screening for postpartum depression in my practice, and then we wrote the protocol for all of our practices in our region, and then they took my protocol and took it to the NICU, was because a lot of moms weren't going to that 6-week visit, whether it was insurance issues, whether it was, just, social issues, life issues. They're coming to the pediatrician. So like I said, I do the 1-month well check. If I have a mom who's seasoned, if this is her 3rd or 4th child, I'll go ahead and give her the opportunity, like, hey, if you're comfortable, everything's good, I can wait till 2 months. But I will tell you, 9 times out of 10, every mom wants to come in for that 1-month check. It doesn't matter if it's their first kid or their 4th kid. I think it's kind of that having that touch point with me is important. And I think just kind of checking in and everything's okay. And it gives us the opportunity to talk. Like, I'll, out of a, we have visits every 15 minutes. What I tell everyone is I'm always running late. So I'm very upfront with that. When I never do a 15-minute visit. And, all my patients understand that, because, the time I'm devoting to them and their child, it may be another child the next time. So I'm going to be, running late. I mean, I can't take care of baby, talk to mom, in 15 minutes and things like that. And I'll be honest, like those first few visits, like, most of the time the baby's doing great. I may have to fix a latch and, check a bilirubin, but I'll be honest, a lot of times it's mom talking to me. It's mom like telling me about her pain. Hey, what do I do about this? And, or, just kind of crying, like really feeling anxious or really overwhelmed. So I do that 1-month visit. And then we kind of start spacing it out. So that 2-month visit is where we start vaccines. We usually talk about what to, expect at the next visit. So I will talk about vaccines at that 1-month visit and just kind of give them the timeline and things like that. And even if you've had a child previously, like, the vaccine, the schedules, things change so much. So you may have a 4-year-old and it may be totally different now. So that 2-month visit is vaccines, head to toe physical. Every time the baby comes in, we do kind of a head to toe. We're going to do a full exam, height, weight, head circumference, everything, heart, lungs, everything. But that 2-month visit where we start the vaccines, and then the next visit, scheduled visit, is at 4, and then after that at 6 months. So those are the vaccine visits. And then 6 months, we start extending to every 3 months, and that'll be the 9-month visit, kind of just like a check-in. We talk a lot about dental health, because teeth start coming, kids are going to become more mobile, kind of safety issues. And remember, at every visit, we're talking about development, like whether they're cooing, whether they're rolling, whether they're, starting to sit up. And then that 12-month visit is important because we do the 1-year vaccines. We check for labs. So right there, if you count the number of visits, that's 7. So yeah. I'm seeing and that's without any sick visits. So I'm seeing a mom and a baby 7 to 8 times in that first year, which, and I have that relationship because who do you trust with your baby? Your pediatrician, right? I mean, that you guys are trusting me with the most important jewels in your life. And so, it's an honor to me that the mothers trust me, not only just with taking care of their baby, but they trust me with some very personal feelings, like whether it's anxiety or sadness or maybe a trauma they experienced, or just, the birth didn't go the way it was supposed to go, or, a divorce, whatever, a divorce, anything like that. And it's really like, it's amazing how many times an OB sees us when we're pregnant. And then, like I said, after the delivery, what we do, the 6-week check.
Yeah.
And I think that's it, and then you might see them at the 3-month, check. And then, you might have an earlier one if you had a C-section, but, it's phenomenal. There's so many organizations, the pediatric organization, the ACOG, the obstetric organization, we're all talking about change in postpartum care and how it has to be individualized because, you're different than you're different than I am, and I'm different than the next mom, so.
Yeah. And I kind of like what we were talking about earlier too. I mean, you are seeing your pediatrician so much, and just all the more reason to really find somebody that you are comfortable with, and that you do have a good relationship, and that you feel comfortable asking questions. I know sometimes I almost feel bad asking questions, and almost feel bad taking up time because you do know that you have limited time. So what advice do you have for parents who maybe are nervous about asking questions, or when it comes to, there's so many decisions that you're making, right? And you don't always know what the best decision is. And maybe somebody made a flippant comment about vaccinations or baby-led weaning, or any number of things, fluoride in your toothpaste, and now you're wondering like, oh well, am I making the right decision? Should I be thinking of something else? Is there a risk I'm not considering? Is there a benefit I'm not considering? I know through pregnancy, I like to teach moms about using the benefit risk framework to help them feel comfortable with asking questions and having those conversations. But what advice do you have for moms who are maybe, or dads who are maybe nervous about speaking up, or don't know how to, how to bring up any maybe concerns or questions that they are having?
Yeah, I think, whether it's vaccines or safe sleep or, weaning, baby-led weaning, or introducing solids, or dental care, like you said, like we were discussing before, there's so much information out there. It's finding the evidence-based information because as we both know, there's a lot of faulty sites and, out there. And, I think just, being honest with your pediatrician, because I would much rather know if, you're dead set against vaccines, early on, because, then we can have that discussion, and I think to your point in the beginning is that finding that pediatrician who you feel can have an open discussion with you. I mean, I don't think you're going to see that, but of course there may be some physicians who practice differently and be like, this is the way it is. And if you don't do X, Y, and Z, I can't see you as a patient. And I have seen that happen. And maybe that's not the practice for you. But, just talking about, what type of formula, or, I'm really hesitant about this vaccine, and really opening that discussion. And what I just had a discussion today with parents who have premature twins. And I said, and they were really kind of concerned about the type of formula. And we talked about the growth and why it's important for their preemies to get these extra calories. And I just kind of went back and I said, so, really kind of what are your concerns? Because if you don't tell us, I don't know to ask, what your concerns are, because all of us are coming from such different backgrounds, or like you said, maybe they heard it from, a friend or a neighbor, or on social media or on TV. And again, just coming to us because we do have the evidence, and it, and I don't expect it to be an open shut case. I think it's just opening up those lines of communication, because then, if a mom is really concerned, like, I am not going to take my antidepressants because I've heard it's bad for breastfeeding. And, you know, as you know, reading from that article,
Yeah.
it is safe to take your treatment while you're
Right.
breastfeeding. And that mom may not believe me, you know, on day one, but
Right.
then, you know, I am going to talk about it, you know, in 2 weeks when I see the baby, or in a month when I see the baby. I'm like, you know, how are you feeling and things like that. I just had a mom today, and, you know, we were talking about it, and she's decided to take her medication. And, you know, we just had an open and honest discussion, and I just kind of started talking to her about, in the time of COVID, and how, you know, the therapy aspect is gone. And we started talking about, you know, having therapy through like telehealth, which a lot of, you know, psychiatrists and therapists are doing, and just
Yeah.
having that discussion, because, you know, we can't assume what our patients know, and our patients can assume how you know, how we're gonna address different topics. And I think just, you know, maybe opening in such a way, like, you know, when the doctor starts asking, like, okay, so what's the baby feeding, how's the baby sleeping, and things like that, you know, you're brushing their teeth, and be like, you know, hey, Dr. Sharma, can I just ask you, is it safe, you know, because I read somewhere that, you know, fluoride isn't safe, or, you know, does my water have fluoride, or I have well water, and things like that. And that's such a great way just to bring it up, because we're not going to know. We are supposed to ask everything, but, you know, if there are 1 or 2 points that are really, really important for this baby or this mom baby dyad, I am going to focus on that. You know, if I'm worried about mom's mental health, I may not ask about the type of water you have, like whether it's well water or you're doing bottled water, just because, like you said, you know, we're in that tight time frame. But I really kind of want to, you know, set the agenda. And I think sometimes our parents help us with that, because I may be focused really on one thing, but you came into the office and be like, I really need to know this. So really kind of helping us recognize as physicians and pediatricians that, you know, hey, I know this is important, but, you know, can we talk about this? And just not, you know, not being fearful about that. And again, if, you know, if you meet kind of that resistance, that it's an open and shut case, but then, like you said, you know, maybe that's not the pediatrician for you. And no physician should ever care for, and should ever get offended, I should say, if you get a second opinion. Like that's, you know, that's kind of what we are taught from the beginning. Like, it is okay to get a second opinion, and no one should be offended by that.
I love that. And that's such a good point that you raised too, that like you do have access to different resources, and, you know, you're more familiar with maybe different places to go to find evidence-based information. You know, you can share with parents, you know, different maybe articles that they can go dig into, or, you know, share, oh, this is a, you know, this is a really well-trusted source where you can go dig further. It doesn't have to be a, you know, like you said, an open and shut case right there in the that 15-minute appointment, but, you know, it can be the beginning of a much longer conversation of, you know, well, let's, you know, this is what I know, and this is, you know, my expertise, and then here's where we can dig further and think about it. And, you know, it's okay to kind of have those kind of ongoing conversations. I love that. What are some of the ways, I think, you know, kind of circling back to what we were talking about in the beginning of this conversation about how, you know, your pediatrician is there for your baby, but what are some of the ways that you have been able to support moms, and, you know, what are some of the ways that you would encourage them to kind of lean on their pediatrician for some support that maybe, you know, isn't quite so obvious? You know, obviously breastfeeding being a big one.
Yeah.
But yeah, I'd love to hear from you guys.
I think I'm really fortunate in the way that, I don't know if I have something on my head that says tell me everything, but I feel very fortunate that moms feel comfortable. Like, I'll have a resident or a social worker go and ask a few more questions, and then, you know, mom is really just breaking down, or, you know, or just that, not necessarily sad tears, but happy tears, just to be able to talk about it. And, you know, the residents are like doctors and pediatricians in training. They're like, what did you say, Dr. Sriraman? We just walked out and they were fine, and you go in and make them cry. I think it's just asking those extra few questions really matter. And I think, you know, as we, just like with any profession, you learn the intricacies. And, you know, it's just, maybe because I'm a mom, maybe because I went through it, it's just, I can just tell when something is not right, or there's something under the surface that, you know, maybe she didn't feel like, you know, telling the nurse who triaged her. Maybe she didn't feel comfortable telling the med student who's working with me that day, which I, you know, completely understand. And it's very different in a teaching hospital when you have a lot of, you know, learners and things like that. So obviously it's very different than a private practice where you may be seeing the same person for 18 years and nothing has changed. And I think just obviously the breastfeeding is so important, but again, it's just the, I think the physical health is important. And I've been learning so much about that over the last year, whether it's in my pediatric practice or my breastfeeding practice, in terms of like the pelvic floor aspect.
Mm-hmm.
And, you know, whether you have a vaginal delivery or C-section, you know, women are amazing. Like I look at these women who walk into my office and who, you know, have these just excruciating pain or the surgery or whether it's a tear, and they're in my office sitting and they're working out the breastfeeding. And I'm like, are you okay? Like, you know, have you taken your, I talk about pain meds a lot. I had 3 C-sections and I tell every single one of my mothers, do not be a martyr. Like, you know, because again, it's that fear, like, well, can I take this medication while I'm breastfeeding? I'm like, yes, you can take this medication because of course, you know, if you're in pain, it's going to affect your breast milk. It's going to affect your sleep. It's going to affect your mood. So I really do talk a lot about that because I myself went through it. And again, like you said, it depending on what the situation was in the hospital. Did someone really take the time to talk to mom about the safety? Because again, every mom is afraid to take a medication while they're breastfeeding, just, you know, just like how we're afraid to take medications when we're pregnant. And so I've been learning a lot about that over the last year in terms of like the pelvic floor aspect. And I think how important that is for our recovery on a physical level, because we do see those sequelae, you know, down the road. Like I'm a runner and I still have hip and back pain. And I know that's from when I had sciatica with my 16-year-old, my son, who's now 16.
Yeah.
But a lot of it was because I just, you know, was seeing patients and I just would walk out of the room and I'm like, something is not right with that mom. And then I started screening and then one thing led to another and just kind of really snowballed. And over the last, you know, 6-7 years, it's really just talking about how mom is feeling, what kind of support does she have? You know, does she have support? Is it adequate support? Is she getting enough sleep? And then, you know, for those moms who may need more support, whether it's a peer support group, whether it's within our hospital or, you know, maybe they need a therapist or maybe they do need medication, and kind of sharing those resources with them and where to find the resources. And I find that because of my work with this, like you said, I have the correct resources. I have literally printed out things from a scientific website and I said, please give this to your psychiatrist. It is safe for you to take this medication while you're breastfeeding. I mean, I have mothers in my office crying. It was just like that New York Times article, like crying because they're suffering and they want to breastfeed so bad. And they think it's an either or choice. And to me, that's just tragic because we have so much information on these medications. The medications I talk about in the article, you know, thankfully are actually, you know, the older the medication, the better, because the older they are, the more research we have on them, the more data we have on them. And these are the medications that are safe. You know, if you have perinatal depression, like some women will have depression and anxiety during pregnancy, it's safe. And for me, I get so angry when I still see moms who are told like, nope, you can't do one. You have to pick. It's one or the other. And, you know, unfortunately, I still see that. So I think that's a great benefit I have as a pediatrician because I get to do both, not just the child's health, but the, you know, mom's health.
I love that. It's just such a great, just great advice, you know, like if you're feeling like in your gut, you know, if your intuition is saying that like, this just doesn't feel quite right. Like the mom who's saying like, no, this doesn't sit right with me, that I can't do both. How can I have both? You know, your pediatrician knows your baby almost as well as you do, right? Like they're a great resource to lean into, to ask these questions of, you know, from any angle, from the breastfeeding angle, the medications, but like you brought up sleep even, you know, talking about safe sleep and really just what a phenomenal resource your pediatrician is. So it's just nice to have that kind of reassurance and reminder, you know, lean into your pediatricians, use them.
Yes, please ask us and just tell us, because, you know, just like you said, depending on the day we're having, or, you know, if we had a really sick kid in the room before you, you know, we may not pick up on some of the signals. So just, at least, or a lot of times the moms have a really good relationship with the nurse because they're seeing the same nurse every time they bring their baby in. So that also is a great option to be like, because they have to do the triage note and, mom concerned about, diaper rash. Mom wants to talk to you about, or not even writing it down. A lot of the nurses will just come and tell me like, mom just wants to talk to you about, X, Y, and Z. It's not, nowhere on paper and things like that. So I think that's also a great resource because, you're generally seeing the same nurse, because the same, weighing your baby and you're talking and, that kind of triage process is, can be, like 10 to 15 minutes that you would, chit-chatting with the nurse.
Yeah, I love that. Any last words of advice or wisdom as, now you're 18 years old is your oldest. So looking back on it, any last like words of wisdom or advice for the newer, the expecting moms watching?
I think it's, so my daughter turned 18 this past week and kind of, I did a post about it and I I was telling you before we recorded kind of that emotional aspect of, but, of course, breastfeeding and vaccines and the, safe sleep, those things are so important. But I think like the minutia things we always worry about. I mean, for me, it was, oh my God, I can't tell you how many sippy cups I went through with this girl. And, the right daycare or the right, music class. And, now it's like, the right sports or, the right, how many AP classes. And I'll tell you right now, I was pregnant on 9/11 with my child. I was in Manhattan and now my daughter has lost prom and graduation because of COVID. So we're kind of in that holding period of if she's going to start college. And, I just look at her and we were talking about this and I think we talk about the mom guilt. I was completely guilted for working and, I beat myself up over that day after day going to work and finishing my training. And, in the end, they're going to be okay. They really are. They're going to be okay. And I think we put so much pressure on ourselves and, whether it's now through social media or, friends or family or what we see on TV. And I think we just have to give ourselves grace and empower ourselves, like whether it's, like you said, picking the right pediatrician or, whatever that aspect is. And I just feel like, kind of looking back, it's, our postpartum journey never ends. Like we're always going to be postpartum because our kids are always going to need us and just really kind of trusting ourselves. And I think that's the difficult part of pregnancy. Like you said, we're making so many decisions and then we're questioning a lot of those decisions and just really empowering motherhood. And I think that's my role. I always talk about like, I care for kids, but I want to empower moms. And I think it's not just in that immediate postpartum period, but, whether it's that 5-year-old who's struggling in kindergarten or that, 10th grader who is, not, getting honor roll or things like that. I have all these discussions all the time. And, those little things I wish, looking back on now, I wish I, hadn't stressed so much about some of those small things. And I'd really wish I had listened to my gut feeling as opposed to caring. I think, there's a lot of opinions out there. And I think learning how to tune those out is important because, in the end, our kids are going to do well. And, we surround them with love and consistency. And for me and my husband, since we didn't have a lot of family around, it's really kind of your village who surrounds you and your kids and who is your support system. And I think as women, having those other strong women friends, whether they have kids your same age or older, I think that all changes in your aspect of life, or working moms or moms who stay at home, just having that village, because we are all such great resources for each other. And I think that, we can kind of help each other, talk each other to like, to be like, okay, let's look at it from this point of view. And when you hear it from someone else, you're like, okay, that makes sense, as opposed to when we're in it. So I think having that strong source, that village and that strong source of women and that the support that we need from our female friends is so important.
Amen to that. Thank you so much for being here and for having this conversation, for being such an advocate for moms, and it's just so wonderful and inspiring and to chat with you. So thank you so much for being here. I will absolutely be putting down in the description. You can find contact information for both of us so that you can continue to stay in touch. And hopefully we'll be hearing from you all again soon. We're just both so happy to have the chance to talk to you. Thank you for inviting us in to be a part of your virtual village. And hopefully we'll both be talking to you again soon. Thanks
so much. Thank you.